Are you curious about the role of vitamin K in blood clotting? Look no further. In this video, we will explore the fascinating connection between vitamin K and the body's clotting system. From preventing excessive bleeding to promoting wound healing, vitamin K plays a vital role in maintaining our overall health. But what exactly is vitamin K? Known for its essential role in blood clotting, vitamin K is a fat-soluble nutrient that helps activate certain proteins involved in the clotting process. Without adequate levels of vitamin K, our bodies may struggle with clotting properly, leading to increased risk of bleeding and delayed wound healing. Join us as we dive deeper into the functions and sources of vitamin K, along with the science behind its impact on blood clotting. We will also address common misconceptions and share important insights on how to ensure you are getting enough vitamin K in your diet. Get ready to unravel the secrets of this often overlooked vitamin and its crucial role in our clotting system. How blood clotting works. Blood clotting, also known as coagulation, is a complex process that helps prevent excessive bleeding when we get injured. When a blood vessel is damaged, the body initiates a series of reactions to form a clot and stop the bleeding. This is where vitamin K comes into play. The clotting process involves several proteins, including prothrombin, which is produced in the liver and requires vitamin K for activation. Vitamin K helps modify the structure of prothrombin, allowing it to transform into its active form, thrombin. Thrombin then acts as a catalyst for the formation of a fibrin clot, which seals the damaged blood vessel and prevents further bleeding. Without sufficient levels of vitamin K, the clotting process becomes impaired, leading to prolonged bleeding and delayed wound healing. This is why maintaining adequate vitamin K levels is crucial for our overall health and well-being. In addition to its role in blood clotting, vitamin K also plays a part in bone metabolism and may have potential benefits for cardiovascular health. Let's explore the different types of vitamin K and their dietary sources. The different types of vitamin K. Vitamin K exists in several forms, with the two most commonly known being vitamin K1 and vitamin K2. Vitamin K1, also known as phylloquinone, is primarily found in green leafy vegetables such as spinach, kale, and broccoli. It is the predominant form of vitamin K in the Western diet and is responsible for approximately 90% of the vitamin K intake in most individuals. On the other hand, vitamin K2, also known as menaquinone, is produced by bacteria in the intestines and can also be found in certain fermented foods. It has several subtypes, with the most well-known being MK4 and MK7. MK4 is found in animal products like meat and eggs, while MK7 is primarily found in fermented foods like natto, a traditional Japanese dish made from fermented soybeans. Both vitamin K1 and K2 play important roles in blood clotting, but they may have different effects on other aspects of health. Vitamin K2, in particular, has been associated with improved bone health and a reduced risk of cardiovascular disease. However, more research is needed to fully understand the specific mechanisms and benefits of each form of vitamin K. Sources of vitamin K in the diet. To ensure an adequate intake of vitamin K, it is important to incorporate foods rich in this essential nutrient into your diet. The best dietary sources of vitamin K1 include green leafy vegetables such as spinach, kale, Swiss chard, and collard greens. These vegetables not only provide a good amount of vitamin K but also offer a wide range of other beneficial nutrients. For those interested in increasing their intake of vitamin K2, fermented foods like natto, sauerkraut, and certain cheeses can be excellent options. Animal products like liver, meat, and eggs also contain small amounts of vitamin K2, particularly the MK4 subtype. It's worth noting that the absorption of vitamin K from food sources can be influenced by various factors. For instance, the presence of dietary fats can enhance the absorption of vitamin K, as it is a fat-soluble nutrient. Additionally, certain medications and medical conditions can affect the absorption and utilization of vitamin K in the body. We will explore these factors in more detail later in the video. Vitamin K deficiency and its effects on blood clotting. Vitamin K deficiency can have significant impacts on the body's ability to clot blood properly. Without enough vitamin K, the production of clotting factors is impaired, leading to a higher risk of bleeding and delayed wound healing. Infants are particularly vulnerable to vitamin K deficiency, as their gut bacteria are not fully developed, and breast milk contains relatively low levels of vitamin K. To prevent vitamin K deficiency in newborns, it is common practice to administer a vitamin K injection shortly after birth. In adults, vitamin K deficiency can occur due to various factors, including inadequate dietary intake, malabsorption issues, liver disease, or certain medications that interfere with vitamin K metabolism. Chronic conditions that affect the gastrointestinal tract, such as Crohn's disease or celiac disease, can also contribute to vitamin K deficiency. The symptoms of vitamin K deficiency may not be immediately apparent, as it takes time for the body's stores of vitamin K to become depleted. However, over time, deficiencies can lead to increased bruising, bleeding gums, nosebleeds, and gastrointestinal bleeding. If you suspect you may have a vitamin K deficiency, it is important to consult with a healthcare professional who can evaluate your symptoms and recommend appropriate testing and treatment options. Health benefits of vitamin K beyond blood clotting. While the role of vitamin K in blood clotting is well established, emerging research suggests that this essential nutrient may offer additional health benefits beyond its clotting functions. One area of interest is the potential role of vitamin K in bone health. Vitamin K is involved in the regulation of calcium, which is essential for maintaining strong bones. By activating proteins that help bind calcium to the bone matrix, vitamin K may contribute to improved bone density and reduced risk of fractures. Some studies have also suggested a potential link between vitamin K intake and a lower risk of osteoporosis, a condition characterized by weak and brittle bones. Furthermore, vitamin K2, specifically the MK7 subtype, has been associated with cardiovascular health benefits. Research suggests that vitamin K2 may help prevent the calcification of arteries, a process that can contribute to the development of cardiovascular diseases like atherosclerosis. By ensuring proper calcium utilization, vitamin K2 may help maintain the integrity and elasticity of blood vessels, supporting overall cardiovascular health. It is important to note that while the potential health benefits of vitamin K are promising, more research is needed to fully understand the mechanisms and establish optimal intake recommendations for different populations. Vitamin K supplements and their role in maintaining blood clotting. In some cases, dietary sources alone may not provide sufficient vitamin K to maintain optimal blood clotting. This is where vitamin K supplements can be beneficial. Vitamin K supplements are available in various forms, including capsules, tablets, and liquid formulations. They can provide an additional source of vitamin K to ensure adequate intake, particularly for individuals at risk of deficiency or those with specific medical conditions. It is important to consult with a healthcare professional before starting any new supplements, including vitamin K. They can assess your individual needs, evaluate potential interactions with medications or medical conditions, and recommend the appropriate dosage for your situation. Additionally, it is worth noting that excessive supplementation of vitamin K can interfere with certain medications, such as blood thinners like warfarin. Therefore, it is essential to communicate with your healthcare provider and ensure they are aware of all the supplements you are taking. Medical conditions and medications that can affect vitamin K levels. As mentioned earlier, certain medical conditions and medications can impact the absorption and utilization of vitamin K in the body. Understanding these factors is crucial for individuals who may be at risk of vitamin K deficiency or those who require specific management of their vitamin K levels. Liver disease, for example, can impair the production of clotting factors and decrease the body's ability to store vitamin K. This can result in a higher risk of bleeding and may require close monitoring and potential interventions to manage vitamin K levels. Additionally, certain medications can interfere with vitamin K metabolism. Anticoagulant medications, such as warfarin, work by inhibiting the action of vitamin K on clotting factors. While this is desired in individuals who need to prevent excessive blood clotting, it also means that individuals taking these medications need to be cautious about their vitamin K intake. It is important for individuals taking anticoagulant medications to maintain a consistent intake of vitamin K and communicate with their healthcare provider about any dietary changes or new supplements. Regular monitoring of clotting factors and close collaboration with a healthcare professional can help ensure optimal management of vitamin K levels in these cases. Vitamin K and its role in preventing excessive bleeding. One of the primary functions of vitamin K is to prevent excessive bleeding by promoting proper blood clotting. This is particularly important during surgeries or invasive procedures, where maintaining hemostasis is crucial for patient safety. In these situations, healthcare professionals may administer intravenous vitamin K to ensure adequate clotting. The administration of vitamin K can help reverse the effects of anticoagulant medications, such as warfarin, and restore the body's ability to form clots. Vitamin K is also used as a preventive measure in newborns. As mentioned earlier, infants are born with low levels of vitamin K, and their gut bacteria are not fully developed. To prevent vitamin K deficiency bleeding, it is standard practice to administer a vitamin K injection shortly after birth. By replenishing vitamin K levels, healthcare professionals can reduce the risk of bleeding complications in both surgical and newborn settings. However, it is essential to ensure appropriate dosing and monitoring to avoid potential adverse effects. Conclusion: importance of maintaining adequate levels of vitamin K for proper blood clotting. In conclusion, vitamin K plays a crucial role in our body's clotting system. From activating proteins involved in the clotting process to preventing excessive bleeding, adequate levels of vitamin K are essential for maintaining our overall health. While vitamin K deficiency is relatively rare, certain medical conditions, medications, and dietary choices can affect our vitamin K levels. Incorporating vitamin K-rich foods into our diet, such as green leafy vegetables and fermented foods, can help ensure an adequate intake of this vital nutrient. In cases where dietary sources may not be sufficient, vitamin K supplements can provide an additional source of this essential nutrient. However, it is important to consult with a healthcare professional before starting any new supplements, especially if you are taking medications or have underlying medical conditions. By understanding the role of vitamin K in blood clotting and taking steps to maintain adequate levels, we can support our body's natural defense mechanisms and promote optimal health and well-being. So, let's make sure we give vitamin K the attention it deserves and keep our clotting system in top shape.